Hello, my dear friends. So, welcome back on my YouTube channel. I am Dr. Arun Swami. In this video, we are going to discuss about the lung volume and capacity. Many students and many persons they get confusion about this volume and capacity. So, in this video, I will try to let you know about all this volume and capacity in a very short and quick manner, so that you can ever remember and you can never do the mistakes while you are solving various MCQs in the various examination. So let's begin about this lung volume and the capacity. So first of all, let's talk about the volume and capacity. What is the volume and what is the capacity? First, you should know about this part. Guys, the lung volume means this is the individual measurable volume of air in the lungs. यानी कि सिंगल वॉल्यूम को अगर अपन जब भी बात करेंगे मीन्स एक बार में कितनी एयर आ रही है, कितनी एयर जा रही है, हाउ मच एयर इज कमिंग, हाउ मच एयर इज गेटिंग आउट, दिस सिंगल इंडिविजुअल मेजरेबल वॉल्यूम of the air in the lungs we call as lung volume. Now talking about the capacity, capacity means that two or more than two volumes when together we are talking about in the combination form we called as the lung capacity. तो वॉल्यूम का मतलब सिंगल यूनिट और कैपेसिटी का मतलब मोर देन टू और टू वॉल्यूम्स को कंबाइन अगर अपन करके जब देखेंगे दैट वी कॉल्ड एज द कैपेसिटी. नाउ so let's begin talking about the different volume and the different capacities like your residual volume, total lung capacity, functional residual capacity, inspiratory reserve volume and your residual volume. So different type of volume and capacity, everything we are going to be discussed in a detailed manner. Now first of all, please try to understand what actually the different volume and what actually the different capacities. Guys, here you can see that you heard many times the word we called as tidal volume. So this is the tidal volume, then the inspiratory reserve volume, then expiratory reserve volume and then the residual volume. So here we're going to study the four volumes. Which one? Tidal volume, inspiratory reserve volume, expiratory reserve volume and the residual volume. When we are going to talking about the capacity, guys, first of all we'll discuss the inspiratory capacity, which is the combination of inspiratory reserve volume and the tidal volume. You can see over here. Then we'll discuss about the functional residual capacity, which is the combination of expiratory reserve volume and the residual volume. And then we'll discuss about the vital capacity, which is the combination of inspiratory reserve volume, tidal volume, expiratory reserve volume. And then we'll discuss about the total lung capacity, which is the combination of inspiratory reserve volume, tidal volume, expiratory reserve volume and the residual volume. Guys, the one thing you have to be understand, एक चीज बेटा आपको हमेशा याद रखनी है, and what you have to be remember that whenever we are calculating the volume and capacity and talking about the volume and capacity, volume means the individual measurable unit and the capacity is that's a combination of two or more than two type of volumes. Okay, so यहाँ पे एक बिल्कुल शॉर्ट मैनर में और वेरी क्विक और कॉन्सेप्ट जो अपना दिमाग के अंदर अपने को बनाना है वो इस तरीके से बनाना है कि सबसे पहले बात करते हैं टाइडल वॉल्यूम. व्हाट इज द टाइडल वॉल्यूम? गाइस, जनरली what quite air we are inhaling and then we are exhaling. What we are doing? Normally we are inhaling the normal air and then we are exhaling. अभी आप इस वीडियो को देख रहे हैं, you are watching this video and simply you are taking the air inside during the inspiration and you are taking the air outside during the expiration. So guys, now this inspiration and expiration, this is not the forceful expiration inspiration, that is quiet, that is normal. So this is your normal inspiration and normal expiration. This normal inspiration and expiration we called as tidal volume. So guys, please pay attention. Generally, how much air you are inhaling as a quiet breathing, guys, this condition, then you are exhaling this inhale air we called as tidal volume. What we call this? Tidal volume. So you can see over here, when the graph is going upside, it means inhalation, then exhalation, inhalation, exhalation. Now here you can see the normal quiet air which you are inspiring, this is actually your tidal volume. And guys, this tidal volume is 500 ml. तो एक बार में आप जनरली जब शांत होके बिल्कुल आप इंस्पिरेशन कर रहे हैं तो एक बार में लंग में कितनी हवा ले रहे हैं? दैट इज योर 500 ml and this air volume we called as tidal volume, right, at the rest. Now please pay attention. when suppose you are seeing, आपने कुछ देखा and you are getting a smell of the samosa or the biryani, guys, what will be happening? You inspired the normal volume, that is your tidal volume, और अचानक से आपको समोसे की या बिरयानी की खुशबू आई, what you will do? You will try to take little bit more air inside, like samosa, like you are trying to take more air inside, right? And this extra air which you are able to inhale, this we called as inspiratory reserve volume. What we call this? Inspiratory reserve volume. Then suppose you are passing through a street, that is some garbage is there, kuch kachra pada hua hai, and that is very sticky, guys. You inhale the air and now you trying to exhale the air, and you want to try to exhale extra air, forceful air, guys. This forceful extra air, that we called as expiratory reserve volume. What we call this? Expiratory reserve volume. तो जनरली अपन जो एयर इनहेल कर रहे हैं, टाइडल वॉल्यूम, एक्स्ट्रा फोर्सफुली जो अपन निकाल रहे हैं, दैट इज एक्सपायरेटरी रिजर्व वॉल्यूम, एक्स्ट्रा फोर्सफुली जो अपन ले रहे हैं, दैट इज इंस्पायरेटरी रिजर्व वॉल्यूम. नाउ प्लीज पे अटेंशन. आफ्टर टेकिंग फोर्सफुल एक्स्ट्रा एयर आउट, फोर्सफुल एक्सपिरेशन कर दिया आपने, जितनी हवा आप बाहर निकालना चाहते थे आपने निकाल दी. नाउ यू स्टॉप योर एक्सपिरेशन, गाइस. आफ्टर दिस स्टॉपिंग, व्हाट यू थिंक? इज देयर एनी एयर लेफ्ट इनसाइड द लंग? क्या अभी भी लंग्स में कोई हवा बची हुई है क्या? यस, ऑफ कोर्स. एयर कैन नेवर गेट आउट 100% फ्रॉम द लंग्स. लंग ऑलवेज कंटेन सम अमाउंट ऑफ द एयर इनसाइड ऑफ इट. अगर सारी की सारी हवा लंग्स में से निकल जाएगी, लंग विल बी कोलैप्स, and this condition we call as atelectasis. So lungs always keep some amount of the air inside of it to prevent the collapse condition. And guys, this, the amount of air which is never going out from the lungs, this is we called as residual volume. What we call this? Residual volume. So this is we called as residual volume. So I hope now everybody understood. Tidal volume means that is the normal inspiration air. Extra forceful inspiration air, inspiratory reserve volume. Extra forceful exhalation, expiratory reserve volume. And the air which is remain after the expiratory reserve volume, that we call as the residual volume. Now guys, please pay attention. If somebody asks you कि how many air maximum you can inhale, please pay attention. How much maximum air you can inhale, कितनी हवा maximum आप ले सकते हैं? तो you can inhale tidal volume, and you can inhale the inspiratory reserve volume. That is the maximum air which you can inhale. And guys, this combination we called as inspiratory capacity, right? This is we called as inspiratory capacity. Now suppose somebody will ask you, after normal expiration, this is the normal expiration, after normal expiration, what is the total air remain inside of your lung? So you can say, sir, expiratory reserve volume is remain and the residual volume is remain, and combination of this both air volume we called as functional residual capacity. And this is the hot shot for examiner always try to ask this capacity, functional residual capacity. Now suppose somebody asks you, how much maximum air you can inhale? So you can inhale that much maximum air. And how much maximum air you can exhale? You can exhale that much air, right? So guys, this is combination of what? This is the combination of tidal volume, combination of inspiratory reserve volume, and the combination of expiratory reserve volume. Guys, both these three volume together we call as vital capacity. What we call this? Vital capacity. So what is the meaning of vital capacity? Maximum inhalation and maximum exhalation, that we call as the vital capacity. Now somebody asks you, okay, how much total air, maximum total air you can inhale or you can keep in your lung at a time? So guys, you can keep maximum air at a time in your lungs from here up to here, guys, isn't it? So maximum जो आपने air inhale करी है, यहाँ से लेके और यहाँ तक की total air एक बार में आपके lungs में रहेगी, and this is we called as total lung capacity. So total lung capacity is combination of inspiratory reserve volume, tidal volume, expiratory reserve volume, and the residual volume. That is your total lung capacity. That is the combination of total lung capacity. So I hope now you can easily understood. Please pay attention, guys. Whenever we talk about how you can measure it practically, So you can measure it via a method we call as spirometry. I will show you in this video how this spirometry actually looks like. So you can measure them via the spirometry. Please pay attention. The all air which can come in and which can go out from the lungs, they can measure by the spirometry. But any air which can never comes out from the lungs, that we can never measure by the spirometry. तो कौन सी ऐसी एयर है जो लंग्स में से कभी भी बाहर नहीं आती है guys? That is your residual volume. So residual volume we can't measure by the spirometry. और जो भी capacity that contain the residual volume, we can also not calculate by this. So residual volume is coming into the functional residual capacity, and this is also coming into the total lung capacity. So these two capacities we cannot measure by the spirometry. We can measure the spirometry by rest of the things, right? So this is how the residual volume, FRC and the TLC, total lung capacity, we cannot measure by the spirometry. So this is how you should be remembered. Generally normal inspiration, tidal volume; extra forceful inhalation, inspiratory reserve volume; extra forceful exhalation, expiratory reserve volume; and after expiratory reserve volume, the air which remain inside the lung we call as residual volume. So here you can see the tidal volume, that is the amount of air inspired or expired during the normal quiet breathing, that we call as the tidal volume. Normal tidal volume is always, remember, this is 500 ml. Guys, generally, when this 500 ml air enters into the lung, guys, this air moving from this area into up to the alveoli. But what happens actually when the air moving inside this lung, guys, from here you inhaled 500 ml, but not all 500 ml will reach up to the alveoli. Guys, the amount of air which is reaching up to the alveoli, this is only and only 350. तो देखो आपने 500 ml air inhale करी थी, लेकिन पूरी 500 नहीं जाती है. How much air only come enters into the alveoli? Only 350 ml. So 350 ml can do the exchange with the blood, and gas exchange can be possible. So guys, out of 500, 350 is reaching, 150 is trapped in between of this tract and this area where this air is trapped and not able to do the gas exchange. This area we called as dead space. What we call this? Dead space. तो देखो बेटा, जब भी कभी कोई काम होता है, लेट्स सपोज, तो जो भी अमाउंट आपको रिलीज करा जाता है, वो कभी भी अमाउंट लास्ट लेवल तक उतना का उतना नहीं पहुंचता है. इन द सेम वे, जो एयर आपने इनहेल करी थी, सारी की सारी एयर एल्वेलाई तक नहीं पहुंचती है. जो एयर बीच में ट्रैप हो जाती है, जो एक्सचेंज नहीं कर पाती है, दैट वी कॉल्ड एज द डेड एयर, एंड दिस एरिया वी कॉल्ड एज द डेड स्पेस. राइट नाउ, सो dead space is for 150 ml, and air reaching up to the alveoli, that is the 350 ml out of this 500 ml. The inspiratory reserve volume, that is after the normal inspiration, the extra air which you can inspire, and the normal volume of this, that is 3000 ml. The expiratory reserve volume, just now we discussed, this is the extra air which you are able to expire after the normal expiration, and the value of this is around 1100 ml. The residual volume, the air which always remain inside the lung, never comes out. This is the amount of air remaining in the lungs after the forceful expiration. The normal value is 1200 ml. And guys, please pay attention, very important. This residual volume is actually prevent the lung collapse, we called as atelectasis. So guys, we can measure all this, residual volume by this helium dilutional method or the body plethysmography, not by the spirometry. So guys, please pay attention. As I told you, residual volume we can measure by the helium dilution method, body plethysmography, but we cannot measure it by the spirometry. Talking about the lung capacity, this is the combination of the volumes we already discussed. Inspiratory capacity, that is the maximum air the person can inspire after the normal expiration, and the combination method is, that is the combination of tidal volume and the inspiratory reserve volume. Then the FRC, that is the air remaining in the lungs after the normal expiration, and the combination, this is of ERV and RV. What is the importance of this FRC? Guys, this act as a oxygen reservoir, very important part. this act as a oxygen reservoir, right? And this decrease during the obesity, in pregnancy, supine position, but it is increase in the emphysema or the COPD. What is the emphysema? That's elastic recoiling property is actually of the lung gone, and this lungs become hyperinflated. That we called as the emphysema, right? So hyperinflated alveoli we called as emphysema. So this FRC is increased in the emphysema. Now, next is vital capacity, that is the maximum air expired after the maximum inspiration, and the vital capacity, that is actually the combination of tidal volume, inspiratory reserve volume, and the expiratory reserve volume. And this is always remember, this is decreased in the RLD, restive lung disease, and in the muscle weakness, or it is increased in the athletes, right? So in the athletes, it's going to be increased. Total lung capacity, that is the total amount of air lung can hold at a time, combination of tidal volume, inspiratory reserve volume, expiratory reserve volume, and the residual volume, right? Residual volume. Guys, spirometry, with the help of spirometry, we can measure tidal volume, inspiratory reserve volume, expiratory reserve volume, and the vital capacity. And this spirometry is actually looks something like this. So you can see over here, this is the graph, and when you are doing the inspiration and the expiration, this is the pulley condition area. This goes up and down, and here it is drawing this graph pattern like this. So this is how this spirometer is actually function. Guys, the body plethysmography, this is the closed area, or you can see the closed chamber. Inside of this, the person is actually doing the exhalation, and this is how you can measure this residual volume, you can measure the TLC, you can measure the FRC. So body plethysmography is actually look something like this. This is the closed chamber over here, which you can see over here. So all this residual volume, FRC and TLC, all they can measure by the body plethysmography, right? So this is what is the clinical relevant. There is the two condition we called as obstructive and the restrictive lung disease. Guys, what is the meaning of the obstructive? Meaning of obstructive is whenever the problem in exhalation, this is we called as OLD, obstructive lung disease, and whenever the problem in inhalation, guys, this condition we called as RLD, restrictive lung disease. So जब भी कभी सांस लेने में तकलीफ है, we called as restrictive lung disease. जब भी कभी सांस छोड़ने में तकलीफ है, we called as obstructive lung disease. So this is how you can differentiate between OLD and the RLD. Guys, in multiple time the question is asked in the medicine or in other areas that which volume and the capacity can be decreased or increased in the RLD and the OLD. So guys, what you can see, what is happening in the OLD? OLD में हो क्या रहा है? OLD के अंदर पे हवा अंदर तो जा रही है, लेकिन बाहर नहीं आ रही. So air trapping inside the lung. So all the volume and capacity can be increased. But in restrictive lung disease, air not able to enter inside the lung. So guys, all the volume and capacity can be decreased. So this is how you can easily remember. That's in obstructive lung disease, residual volume, TLC, FRC, and the vital capacity, all residual volume, TLC, and FRC, all they actually increase, but the vital capacity, person is not able to properly expire the do the expiration. So there is a problem in the expiration. That's why the vital capacity is decreased. Right? Now please pay attention. In restrictive lung disease, everything will be decreased. So you just remember, in obstructive lung disease, only the vital capacity that can be decreased, rest all thing will be increased, but in restrictive, everything will be decreased, right? Now the dead space, just now we discussed. So the area where actually the air is conducting, and this conducting zone when traps the air, we call as the anatomical dead space, and this space is around for 150 ml. But if suppose the air which is reaching up to the alveoli, यानी कि जो air alveoli तक पहुंच तो गई, लेकिन that cannot able to do the gas exchange. Guys, this air we can also say the dead air. and the area where this exchange cannot be take place at the alveolar site we called as the alveolar dead space. But ideally this not happen. Ideally only the air that cannot take the part in gas exchange, only that is the anatomical dead space air. But alveolar dead space air can never do this condition, they always do the gas exchange. So ideally alveolar dead space is always around 0 ml and this is around 150 ml. So what is the physiological dead space? This is the combination of anatomical dead space and the alveolar dead space. So anatomical dead space is 150 and alveolar dead space is 0. So normally this is the physiological dead space is equal to anatomical dead space. So this is how we can remember, right? Now let's practice few MCQs. A medical student performs the spirometry on a patient and wants to calculate total lung capacity. Which of the following components cannot be directly measured using the simple spirometry? So guys, you know, the spirometry cannot measure residual volume, FRC and the total lung capacity. So guys, here you can see that residual volume cannot be measured by that spirometry. This residual volume we can measure by the body plethysmography. Right? Or either helium dilutional method. Coming to the next, a patient in ICU is mechanically ventilated. The tidal volume is 500 ml and the anatomical dead space is 150 ml. How much air is actually reaches alveoli per breath? So we know if 500 person is inhaling up to the alveoli reaching only 350 ml and 150 ml trapping in the anatomical dead space. So right answer of this question is C. Right, that is your C. Now coming to the next, a patient with interstitial pulmonary fibrosis. Guys, you can see the fibrosis. Fibrosis means the stiffening of the lungs. Lung cannot be expand. So whenever we are doing the inspiration, ideally the lung should be expand. So if the person is not able to expand the lung, the person will not able to take the air inside properly. So problem in inhalation will do. So problem will be in inhalation can be occur. So guys, this is a type of RLD. This is a type of a RLD condition, restrictive lung disease. So a patient with interstitial pulmonary fibrosis complains of progressive exertional dyspnea. The pulmonary function test PFT would most likely show. So what happening in the RLD? In RLD everything will be decreased. Just now I told you ना कि OLD के अंदर तो सब कुछ बढ़ेगा except vital capacity, लेकिन RLD में सब कुछ कम होएगा include the vital capacity. So here you can see everything is increased, so they are the wrong answer, but here C is decrease, that is vital capacity and total lung capacity, right? Now then one more question. A 65-year-old chronic smoker presents with the progressive breathlessness and the barrel-shaped chest. The pulmonary function test reveal increased residual volume and the functional residual capacity. The underlying mechanism is that, guys, this is actually the case of emphysema. And emphysema is a type of OLD because the most common cause of emphysema is the smoking and the second one is the alpha-1 antitrypsin deficiency. So you can see over here the emphysema is the OLD, and in OLD what is happening, there is a trapping of the air, right? So what is happening, there is the air trap, air cannot be come out because there is poor elasticity of the lungs. So guys, this is how you can easily identify what is the mechanism behind that. The mechanism of behind that is air trapping due to the loss of elastic recoil, and this is the clear-cut case of the emphysema or the OLD. So I hope now you can easily understood what is the volume and the capacity, and such question when comes in your examination, you can easily do the proper application, how you should do your approach, and you can easily answer them properly, right guys? So this is all about your lung volume and capacity. Thank you very much. If you like this video, kindly like and share and subscribe this channel. Thank you very much.